Hi, my name is Dr. Nayanji Chaudhary and I work for Public Health Institute, Oakland, California. As part of this program, I am also associated with an initiative in India, which we are calling as Adolescent Health and Nutrition Initiative, essentially to help develop school-based programs for adolescents around their health needs, health problems, helping them improve their ability to take care of their own health issues and become stronger and healthier citizens as and when a person suffers from a heart attack or collapses and no medical emergency service is available in the vicinity immediately. So in those cases, these trained and certified bystanders can provide the necessary emergency response to revive the patient until a medical service is available, or at least one can make the patient reach the nearest hospital for further care. A basic CPR training program, CPR is cardiopulmonary resuscitation, is part of the BLS course that we are teaching today, but all this will be offered in a holistic approach that teachers can take home and then practice whenever the right opportunity and time arises.
Hi, my name is Ayushi. I am pursuing MBA in Healthcare Management from Asia Pacific Institute of Management. Today we had a session of BLS training, which is basic life support training. We also got to know about the CPR technique, which is cardiopulmonary resuscitation. This technique is really very helpful in one's life. I would recommend you all should know this, have been trained for this, because you can help someone as a bystander. You can help someone in emergency situations. If somebody falls with a cardiac arrest in front of you, become collapsed and unresponsive, you can really help them, and it means a lot. It means a world to them if you save their life until the emergency help arrives, until the ambulance arrives. So it is really very helpful, and I would recommend it to all of you.